everyone, this is Dr. Tim Newton with Inspire Movement Physical Therapy. In today's video, we're going to show you how we treat segmental restrictions in the cervical spine. This can help with conditions like headaches, neck pain, and even that annoying between the shoulder blade pain. So let's get to it and show you how we do it. For everything we do, we want to make an assessment before we treat and after we treat to know that we're still on the right track with what we're doing. So first we're going to take a look at cervical range of motion. That's how well she moves the neck. So one good thing to look at in the beginning is turning to the right and the left. So we'll do each direction. So going to the right. Okay, that's as far as she goes there. So she's a little bit limited, maybe about 50 degrees of turning there. And then she'll go to the left and a little bit farther there, eyeballing it probably about 60 degrees, maybe 65. And then we'll look at her going up and down, looking up toward the ceiling and down toward the floor. She's a little bit limited in both of those. She's probably got about 50 degrees of each of those. So that's our baseline, and we'll recheck afterward. Before we go in and do any kind of segmental treatment to the cervical spine, we need to first make sure that we have assessed and treated any restrictions that are in the upper back, that's the upper thoracic spine, and the upper rib cage. And the reason for that is because when we have restrictions in those vertebrae of the upper thoracic spine or the upper rib cage, it causes the muscles of the neck to be tense. And until we release those restrictions down lower, the tension in the muscles of the neck will persist. And when these muscles are tense, we're not going to get anywhere with our neck treatment. So the order of treatment and assessment is very, very important. So we're assuming that we've already done that. If you have any questions about how we do that, we've got videos on that, on upper thoracic spine treatment and rib cage treatment. So I encourage you to check those out. But we're assuming that we've already done that, and now we're going to go in and show you how we get in on the vertebral level, treating each segment of the cervical spine. Another thing that we can do to assess before treatment and recheck after treatment to ensure that we are on the right track with our techniques is an assessment of the shoulder mobility. We're going to look at how flexible she is in internal and external rotation. So it's very easy. She just relaxes her arm. And I stabilize her collarbone. And I just let the arm itself drop until I feel the collarbone start to pop up. So if this were 0 degrees and parallel with the floor would be 90 degrees of internal rotation, she drops down to probably about 50 on this right side. Again, stabilizing here because I don't want the shoulder to start riding up. At that point, it's no longer purely ball and socket motion. It's very important that I stabilize this joint to ensure that I'm feeling what I think I'm feeling. Stabilizing here, now we're checking external rotation. And she's at about 90 degrees there. All right? And those are good values. We're going to now check the left side. Now this one internally rotates a little bit less. I would say this may be about 35 degrees. So that's something I want to be aware of. Any asymmetries are significant. And this way is about 90, similar to how it was on the right side. So both sides have good external rotation, but we have a little bit of a limitation in internal rotation in the muscles of the left shoulder. Excuse me. So now we have some data going into our treatment. We're going to get in and do it. We're going to start with a general technique called cervical traction. Okay? Now this isn't a traction machine, all right? Some of you guys out there may have gone to a PT clinic and got hooked up to a machine. This is a manual cervical traction. And all I'm doing is cradling her neck, and I'm giving a gentle pull. What I'm doing is I'm pulling her head toward me. And if you think about all the vertebrae stacked on top of one another in the neck, I am decompressing them. I'm decompressing the joints of those vertebrae on top of one another. And I can hold here for as long as 10 minutes if I want to, 5 minutes, sometimes even just a minute. We're going to hold for just a few more seconds here to move along with our treatment. But this is a good first thing to do, just to decompress the neck, decompress those segments. And we need to remember too that the nerves are running out of the neck, down the arm. They're coming out between these vertebrae of the neck, right? The vertebrae are the bones that are stacked on top of one another in the neck, and between each two vertebrae, on the left side and on the right side, the nerves are coming out and going down the arm. So if you have nerve pain going down your arm, this can be a very, very effective treatment to help decompress the nerves themselves that are getting pinched in between those vertebral bones. So she's relaxing her head. I'm pulling. Normally I'd go a little bit longer, but we're going to take a little break here so we can move along. And we reassess. So we're going to take a look at internal rotation on the right shoulder. Relax here, let it drop. And this drops down actually a little bit farther. I wasn't expecting it. I'd say this is probably about 55 degrees now instead of 50. So we got a little more mobility in the right shoulder just by pulling on the neck. And then we're coming back now. This is 90 again, so that's the same, that's unchanged. And now we'll look at the left side. Internal rotation on the left side last time was 35, so I want to check, just relax here, to see if we have any more, and just let it drop. And we drop down, 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 and right here is where I feel it take up. And this is honestly probably more than on the right side now. This is about 60 degrees of internal rotation, and her collarbone isn't popping up until I get down to 60 degrees. So that was a very significant change just by giving a little bit of a manual cervical traction to the neck. You're probably wondering, why on earth does that happen? This is 90, same as it was before, so this is unchanged. You're probably wondering, now why the heck did that happen? Well, if you think about it, it's all connected. The muscles and the nerves of the arm and shoulder run right up into the neck. So when the neck is happy, the arm is happy. And more mobility is always what we're looking for. If we're gaining mobility, that means that the tissues are relaxing, muscles are relaxing, we're decreasing tension, and things are happier and less painful. Now we're going to go in and do a segmental assessment and treatment. This was a general technique, but now we're going to show you how we get in specifically between very individual vertebrae. To look at the individual segments in the cervical spine, we come underneath the patient's neck, and we're going to get our fingers underneath, locking in under an individual segment. And then from there, we're just going to gently take it side to side and feel how it moves. And what I'm taking note of is if I can move it one way easily and then the other way, it stops. That indicates to me an asymmetry in movement, and that is significant. So that's what guides me. There are 7 vertebrae in the cervical spine, and we just go from top to bottom, feeling how each one moves. The top one is called C1, the next one down is called C2. We're actually not going to be assessing C1 because that is a special vertebra. It's called the atlas, and it is part of the upper cervical spine. We've got a video on how we treat that. If you want to know more about it, I highly encourage you to check that out. So now we're on C2, and I've got her neck tipped back a little bit because that's the direction of movement that I'm interested in assessing right now. And I shift her side to side, and I just work my way down. She is totally relaxed, so I can feel how well she moves to each side. And you can see it's not a whole lot of effort on my part, it's not a whole lot of pressure. I'm just working my way down to the bottom. Sometimes, like I said, if the thoracic spine is tight, everything on one side will just seem tight. And in that case, I need to back up and say to myself, all right, you know what? There might still be something lower down that I need to treat first. I need to go back and clear restrictions in the lower spine, in the thoracic region, and then I'll come back and all of that restriction often disappears. So just a reminder that order of operation is very important. Now I did find a restriction here. All right, she did not move very well to the left, and this is around C5. All right, so I come down to C5 here, and what I'm going to do is try to, with my fingers, get it to rotate and bend the way that I want it to move. Okay, we're on that segment now. So I've got it between my fingers. I'm stabilizing the segment right underneath it, which is C6. And then I'm going to take it as far as I can, bending and twisting to the right side. And you can kind of see my left arm coming up, and it is at the limit. All right, so I started here, I rotated up, 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 bent a little bit, and bam, right there, that was the limit. So I back off that a little bit. I'm not trying to beat this thing into submission. I'm not trying to overpower it. I'm trying to work with it. So right here at its limit, that is where treatment occurs. Now, what I do is I try to get her to induce her neck to do a little bit of a muscle contraction. And we can actually do that by moving the eyes. Go ahead and look down and to the left. As she moves her eyes, I can feel a tiny bit of muscle tension increase in her neck. This is a built-in reflex. We all have it. Relax the eyes. Our eyes and neck are built and meant to work together. So she just relaxed, and after she relaxed, I felt I could take the joint a little bit farther. Go ahead and look down to the left again. These are very small movements. It's hard for you to see. And relax. But what I'm doing is I'm taking advantage of her muscles contracting, and then once they're done contracting, they're a little extra relaxed. And that extra relaxation enables me to take the joint a little bit farther because those muscles are a little bit looser. Look down and to the left again. Relax. And we're doing these tiny movements, but they're at a very specific spot, a very specific segment in the spine. One last time, down and to the left. And relax. And after every time she relaxes, I try to take the joint a little bit farther. I try to work it farther and farther until I'm no longer getting anywhere. So I would call that treatment complete for a restriction in the neck. After this, I would also want to assess the segments with her head up, right? I want to see how well her neck moves as she is tipped forward. We just checked it, how well she moved when she was tipped backward. That's half of it, and then the other half, I would take her up here and then shift her side to side, top to bottom, just like we did before. So that way we're kind of assessing all quadrants of her mobility. So that is how we do it. That is how we check segmental restriction in the cervical spine, assessment and treatment. Now we're going to show you a reassessment here just to see if we got lucky with her internal rotation on the right shoulder. So we did the traction. The left shoulder increased its internal rotation from 35 to 60 degrees, maybe even 65. It was very significant. Now we're going to see if this went any farther. It went from about 50 to about 55 degrees. So now we're going to see if it drops down any farther. Just relax this. and it stops right about here, and this is about 70. So we got more shoulder mobility in each shoulder, each one from a different technique for the neck. We may even be able to get a little bit more if we spend a little more time working on the neck, but this is just another way to demonstrate the relationship between the neck and the muscles of the shoulder and gaining more pain-free mobility. Finally, we're going to take a look at the cervical range of motion that we looked at before. So we'll start with the rotation from side to side like we had before. So go ahead and turn to your left. All right. That's a lot better. That's probably about 75 degrees, maybe even 80. Right, and now turn to the left, the right. Okay, and that is a little bit better. I think she could still stand a little more treatment, but I would call this about 60 degrees. So that was better than the 50 that we started with. And now let's have you look down chin to chest. All right, it's probably about 55 or 60 there, a little bit better. And then look up to the ceiling. I would say that's also about 55 or so. So a little bit of improvement there. She could probably stand a little more treatment to get a little more mobility. We saw a lot of improvement in the shoulder mobility, but this was a good start, and this is how we check and recheck when we treat the cervical spine. Those are a few of the things that we can do to begin addressing problems in the neck. If you found this video helpful, leave us your questions, your comments, subscribe and give us a like, and don't forget to check out our website for more related material at marylandmanualtherapy.com. Thanks for watching, and have an inspired day.